Hello everyone, I am moderating today's group discussion on a real-world application of the concept of focus and context in data visualization. We will be using the example of COVID-19 dashboards that many governments used during the pandemic situations. Let's dive into the discussion with thoughts from each of the four participants.
Speaking as visual design enthusiast, one of the major problems in the initial version of the dashboard was visual clutter. Everything, new cases, vaccination progress, hospital bed count, regional case maps, was given the same visual weight. There was no clear starting point for the user. In terms of design, there was a lot of context but absolutely no focus. Users were confused about what needed their attention. First, it was like entering a room where everyone talks at once. Visually, the dashboard wasn't guiding the user. The absence of focus made it overwhelming.
Now, speaking as a data analyst, from a data analyst perspective, that's a key problem. The user doesn't just need to see data, they need to understand it quickly. When every chart is equally bright, bold and detailed, it's hard to interpret. After the redesign, the interface added focus by highlighting the user's district or region. The numbers for your area appeared first and were styled more prominently. Meanwhile, the surrounding areas were still shown, but they were visually minimized. This was classic focus and context, letting you zoom into relevant data while still maintaining an overview of the national trend. This change made a big difference. Now, users could say, okay, my district has rising cases, but nationally, the trend is falling. That is valuable, actionable insight.
Speaking as a public health student, as someone studying public health, I found this really impactful. Public dashboards have a responsibility not just to inform but to communicate clearly during a crisis. When people could see how their own district was doing, with numbers, colors, and trends, focus on them, they paid more attention. Before the redesign, people felt disconnected. But after focus was added, people engaged more. When you feel like the data is about you, you're more likely to change your behavior, wear a mask, avoid gathering, or encouraging others to get vaccinated. The focus helped personalize the message, while the content made it public, trusted by not hiding the full picture.
Now speaking as a tech developer, from the development side, implementing focus and context isn't terribly difficult with the right tools. The term used Now speaking as a tech developer, from the development side, implementing focus and context isn't difficult with the right tools. The team used techniques like zoomable maps so you could dive into your district, bold coloring for the current regions while others being faded. A combination of overview plus detail views where you see a national graph and can click it to see local data. This approach makes dashboards interactive and informative. And this technique isn't limited to COVID data. You can use it in sales dashboards, which focuses on a product, context of full inventory, student performance reports, and that focuses on one student, context of class average, environmental monitoring, where we focus on rainfall in one area, and context of state level variation.
Thanks everyone for sharing your views. Before we wrap up, let me summarize a few key takeaways from this discussion. The original dashboard failed because it lacked the focus. User didn't know where to look first. The redesigned version succeeded by highlighting what's most important and giving users a clear starting point, their own district, while still focusing surrounding the information. Focus on context help us to not just in visual design but in shaping the user behavior and understanding. These principles apply across many fields from education to e-commerce. The biggest challenge is finding the right balance. Too much focus hides the big picture and too much context hides the meaning. And with that we conclude the today's session. Thank you.